Hi everybody. Today we are going to learn about pneumothorax and tension pneumothorax. What is pneumothorax? When air accumulates in pleural space, it increases the pressure, causing lungs to collapse. It can be partial collapse and total collapse. If you look at the lung, this is the normal lung, and when air accumulates in the pleural space, causing lung to collapse, and this is the picture of collapsed lung. So what is pleural space? If you see the anatomy of lung, the lung is covered by two pleural membranes, outside parietal pleura and inner visceral pleura, and the space between these two pleural membranes is known as pleural space or pleural cavity. It always has negative pressure. So what happens in this pleural space or pleural cavity? Air accumulates, that is pneumothorax. The pressure increases, causing lung to collapse. Now let's see the types of pneumothorax. Pneumothorax, the types or causes can be spontaneous or traumatic. What is spontaneous? As the name explains, it happens spontaneously, no specific cause. So what is traumatic? There is trauma or injury to the chest. Spontaneous can be two, primary or secondary, and traumatic can be open or closed. Spontaneous. What is primary spontaneous? No specific cause. It is due to the sudden rupture of bleb. What is bleb? It is air blisters or thin-walled sac of air. When it ruptures, air leaks into pleural space, causing lungs to collapse. It is usually seen in tall, thin males at the age 20s, and smoking increases the risk. In secondary spontaneous, no specific cause, but usually have other underlying lung disease, example pneumonia, COPD, etc. Now let's see traumatic. Traumatic can be open and closed. What is open traumatic? There is open chest wound, as seen in gunshot or knife stab. When there is an open chest wound, it can cause injury to the pleural membrane. Air accumulates, causing pneumothorax. What is closed traumatic? There is no wound, there is no open wound, but there is a blunt trauma to the chest. Example, when a person falls from a height, it can cause a fracture, injury to the pleural membrane. Air accumulates, causing pneumothorax. How is pneumothorax diagnosed? By chest x-ray and by CT scan of the chest. Now let's see the signs and symptoms of pneumothorax. The signs and symptoms depends on severity. Patient may experience shortness of breath, dyspnea, pressure or pain, chest pain, and usually it worsens with inspiration. Increased heart rate, tachycardia. Increased respiratory rate, tachypnea. And as the severity increases, patient may experience cyanosis. There will be absent breath sound on the affected side. Blood pressure may drop, confusion, loss of consciousness. These severe symptoms are usually seen in tension pneumothorax. What is tension pneumothorax? It is the most severe form of pneumothorax. When air accumulates in the pleural space, when this lung or pleural membrane acts as a one-way valve, that means air accumulates but the trapped air cannot escape. As the pressure increases, it leads to total collapse of the lung. The intrathoracic pressure increases, so the trachea and mediastinum, where the heart occupies, pushes towards the unaffected side. If you look at the trachea, there is a tracheal shift. It's not straight. It gets shifted to the unaffected side. The blood venous return to the heart decreases. Blood pressure may drop. It is a life-threatening emergency. The blood pressure may drop. Patient may have respiratory distress and circulatory compromise. It's a life-threatening condition. Now let's see the treatment of pneumothorax. The treatment depends on the severity. Small pneumothorax resolves by its own. In tension pneumothorax, the treatment is needle decompression. That is, a large bore needle is inserted into the second intercostal space. It relieves the trapped air, followed by a chest tube insertion. Second, chest tube insertion. A tube is inserted into pleural space. It drains the air and helps lungs to re-expand. In case of recurrent pneumothorax, patient may need surgical procedure called pleurodesis. What is pleurodesis? A chemical agent is inserted into the pleural space. This is pleural space. A chemical agent is inserted into pleural space through a tube. It causes scarring of the tissue and prevent recurrence. It causes scarring, adheres the membrane, and prevent reoccurrence of pneumothorax. Another treatment for recurrent pneumothorax is VATS. What is VATS? It is video-assisted thoracoscopic surgery. It is minimally invasive. A few incisions are made, small incisions are made, and a fiber optic camera is inserted. And the surgeon is able to visualize the lung, pleural membrane, pleural cavity. Surgical instruments are inserted and leaking areas or blebs are identified and closed it off. Hopefully you understood pneumothorax and tension pneumothorax. Thank you for watching my video.